What causes recurring ear infections in young children? Imagine a little one tugging at their ear again and again. Ear infections are incredibly common in young children, especially in the middle ear, which doctors call otitis media. Most children will have at least one ear infection before they start preschool, but some experience them repeatedly. Understanding what causes these recurring infections can help parents and caregivers support ear health and prevent complications. The middle ear is connected to the back of the nose and throat by a small tube called the Eustachian tube. This tube helps balance air pressure, drain fluids, and ventilate the middle ear. In young children, these tubes are shorter, more horizontal, and narrower than in adults. This anatomy makes it harder for fluids to drain out, especially when they become swollen or blocked during colds, allergies, or other respiratory infections. When fluid builds up, it creates a perfect environment for bacteria or viruses to grow, leading to infection. Children are more prone to recurring ear infections because of several factors. Their immune systems are still developing, so they are less able to fight off infections. The Eustachian tubes in children are smaller and more horizontal, which slows drainage and increases fluid buildup. The adenoids, which are lymph tissue near the Eustachian tubes, are larger and more active in children. Sometimes bacteria can hide in the adenoids, causing repeated infections that spread to the middle ear. Additionally, young children often have difficulty blowing their noses properly, which can cause mucus to accumulate and block the Eustachian tubes further. Common triggers for recurring ear infections include upper respiratory infections like colds and flu, which cause swelling and mucus buildup. Allergies can also cause similar swelling and fluid retention, blocking the Eustachian tubes. Environmental factors such as exposure to cigarette smoke, crowded daycare settings, and seasonal changes can increase the risk as well. There are different types of middle ear infections. The most common is acute otitis media, which causes sudden ear pain, fever, and sometimes fluid behind the eardrum. Otitis media with effusion happens when fluid remains in the middle ear after an infection clears, sometimes affecting hearing without active infection. Chronic otitis media involves persistent fluid or inflammation that does not resolve, which can lead to more serious issues like hearing loss. From the perspective of hearing health, recurring ear infections can temporarily impair hearing because fluid in the middle ear muffles sounds. Usually, this hearing loss is temporary and improves once the infection clears. However, frequent or long-lasting infections can sometimes cause longer-term hearing problems. In rare cases, chronic infections can lead to structural changes in the eardrum or middle ear bones, which might cause lasting hearing difficulties. If a child has more than 3 ear infections in 6 months or 4 or more in a year, it is considered recurrent and should be evaluated by a healthcare professional. Persistent fluid, hearing problems, or speech delays are also signs that medical advice is needed. Early diagnosis and treatment can help prevent complications and support healthy hearing development. Parents can help protect their child's ear health by encouraging good hand hygiene to reduce infection spread. Keeping vaccinations up to date is important because some vaccines can prevent illnesses that lead to ear infections. Avoiding exposure to cigarette smoke is also crucial, as smoke can irritate the respiratory system and worsen ear problems. Monitoring for signs of hearing difficulty, especially after ear infections, allows for early intervention. Remember, most ear infections in children are common and resolve without lasting effects. However, recurring infections should not be ignored, as they can impact hearing and overall well-being. Always consult a healthcare professional for personalized advice and treatment options. Taking steps to maintain ear health and seeking timely medical care can make a big difference in your child's comfort and development.